Hi, I'm Christiana Casanova. I'm the nurse practitioner here at Cornerstone, and we are going to be doing stem cell injections today on patients. We actually have a couple of patients scheduled today for stem cells. One is going to be a shoulder and the other one's going to be a knee. So when we get our stem cells, they come from a company called Palagen, and we've been using this company since we started doing this. They're a very reputable company. There are many other groups that are similar to what we do who also use this company. They have a great reputation, and we feel comfortable and confident with the product that we get from them. On the top of the box, it actually says donated human tissue for transplant. So this is considered human tissue, and we are transplanting it in a way because we're putting it into someone's joint. But these are cells that have no identity, so it's not your normal transplant where you have to worry about rejection and things like that. These are cells that go into the joint, and then they form an identity of the person that they go into. So when we get our cells, they come in a big, heavy box like this, and they are actually packed in dry ice. And they stay frozen very, very cold. And usually I leave them like this until they are ready to be put in the patient. I don't want to get them, the cells will die if you warm them up and get them activated too soon. So each one of my patients who's doing this today, there's 2 different boxes that are in here for those 2 patients. This is 1 milliliters of stem cells that's going to be inside of this box. And so we will be warming this up shortly to put in our first patient today. The stem cells are actually mixed with some lidocaine, preservative-free lidocaine. If you use any other type of additives, those additives could cause damage to the stem cells. So anything that they're mixed with has to be preservative-free. I try to create as much of a sterile as possible because we are going into a joint. So we try to keep the integrity of the joint as clean and sterile as possible. We use an ultrasound machine to look at the joint and to decide exactly where we want to put the stem cells. And we also take into consideration the x-rays that we've looked at previously as well when we decide where we're putting the stem cells into what part of the joints we want to go. So that is how we will proceed today with our stem cell injections.